Hello, my name is Keisha, and I'll be talking to you about skin-to-skin contact, including how it relates to preterm infants. What is skin-to-skin contact? It's when an infant is placed naked or only wearing a diaper on the naked chest of a mother, father, or other caregiver. This term is used interchangeably with kangaroo care, although kangaroo care is more specifically when the infant is placed in an upright position between the caregiver's breasts, much like the way a baby kangaroo is carried. Skin-to-skin contact was first studied in Colombia in the 1970s during a time when they had a shortage of incubators. When these Colombian babies who were not incubator kept seemed to thrive, it was clear that this was something that needed to be studied more. It was previously understood that preterm infants needed to be in incubators in order to provide a low stimulation environment. However, studies have indicated that there is reduced cortisol levels and increased physiological stability in preterm infants who engage in skin-to-skin contact with the mother, meaning the babies are less stressed when they have the opportunity to engage in skin-to-skin care. The other benefits to the infant include stabilization of respirations and oxygen saturation, increased thermal regulation, decreased apnea and bradycardia, increased infant self-regulation, decreased crying, improved neurodevelopment, increased weight gain, decreased pain response to painful procedures, and increased incidence and duration of breastfeeding. Preterm infants tend to have lower rates of breastfeeding due to difficulties latching. They are at an increased risk for bradycardia, hypoglycemia, jaundice, respiratory distress, sepsis, temperature instability, hospital readmission, and feeding difficulties. Breastfeeding a preterm infant is more difficult than breastfeeding a term infant, but skin-to-skin helps the mother to read the baby's feeding cues. Without going into too much detail about the benefits of breastfeeding, which is a whole other topic, we know breastfeeding is highly beneficial to both the mother and the baby, and so the World Health Organization has developed the 10 steps to successful breastfeeding, a list of guidelines based on substantial evidence that these improve breastfeeding rates. They recommend these guidelines to be followed anywhere care is provided to mothers and babies. One suggestion on the list is to facilitate immediate and uninterrupted skin-to-skin care and support mothers to initiate breastfeeding as soon as possible after birth. Kangaroo care has significant benefits to the mother as well. It decreases the incidence of postpartum hemorrhage, increases milk supply, and increases the mother's confidence in her ability to care for her baby. More research is needed to determine the optimal length of time for kangaroo care, but positive outcomes have been documented in studies with only an hour a day. And continuous kangaroo care has been shown in developing countries to reduce morbidity and mortality in newborn babies. So finding a balance between 1 hour and continuous skin-to-skin care depends on what is best for the individual family. According to a systematic review of experiential studies with parents, the expectation to provide continuous skin-to-skin care can be burdensome and draining, especially when the family has other children, work responsibilities, etc. Circumventing these challenges can include encouraging other caregivers and family members besides the mother to provide skin-to-skin care, as this is also beneficial. The most important message to take out of this is to encourage as much continuous skin-to-skin care between infants and caregivers in a way that respects the caregiver's availability, and teach parents about the benefits of skin-to-skin care, especially with infants who are premature, to enhance their motivation. Thank you and have a pleasant tomorrow.